So we're going to film Chris now getting her masseters injected in. But I want to hear why do you get this injected, Chris?
Honestly, because when I hate my picture taken, and the main reason is when I do get my picture taken, I have to make sure it's on one side because I am so big on one side. It just makes me look heavier than I am.
Okay. So typically, patients who will get their masseters injected, there's a couple indications. It's common in women because large masseter muscles, these muscles right here, can give you kind of a masculine look. And a lot of people get it on both sides. It's also very common in the Asian population. And it's very popular in Asia to have the masseters injected. The other thing is there are some people that really bite down a lot and they end up with TMJ or even headaches or clenching or grinding of their teeth. And this helps it helps with that as well. So the first thing we do, it is nice to put some topical anesthesia on the area, and we mark it out. Now, let me just turn, when you're examining a patient, go ahead and bite down, Chris. You can actually feel the muscle right there, and man, Chris has got rock hard masseter. That is a monster. As Chris is biting down, you can really feel how hard they are. I'm going to have you turn. And her primary problem is here on the right side. And what we do, now you can go ahead and relax, Chris. So we relax the patient. She's had some topical anesthesia, and someone's been kind enough to mark this out for me. So we pretty much have it isolated. And we will put a little ice on there, but typically the patients use between about 10 and 20 units per side. Botox really reaches its maximum effectiveness at about 2 weeks to 4 weeks, but this happens actually fairly quickly, and you can see a result pretty quickly, can't you, Chris? Mm-hmm. Yeah. So we're going to do again 20 units on each side here. We know right where we want to put it, and I space them out probably about a half a centimeter to a centimeter apart where I put in my injections. So you've had a little topical on there, right, Chris?
No.
Oh, okay. You're just tough?
I am.
All right.
You're doing good.
There's the video there.
You just hold the button down. And this is it. It's really quite simple.
Yeah, it doesn't hurt at all.
Doesn't hurt?
Mm-mm.
Okay. And what we'll do is we will pair some of these together with her before and after photos so you can actually see the result. I think in the photo we have, it's when you've been injected before on both sides. Is that right, Chris?
No, the photo that we have I took today showing the...
Just primarily the right side? Okay. Now, for those injectors, you do want to go down a little deeper because the muscle is, down deeper. You don't want to go right under the skin, just like you do with, like you would when you're injecting, like for example, the glabella or any of the other facial muscles. You can go pretty superficial. You go just below subcutaneous tissue with those, and in those patients, you'll be right on the muscle, and the Botox adheres to directly right to the muscle. So that's it. Pretty easy.
Easy.
All right, so we'll just wipe off the marking and get her back to work and productive today, right? Mm-hmm. All right, that's it.
All right, thank you, Dr. Williams.
You're welcome.